She would cry, you know, it would hurt, and she'll, you know, walk around like to say, oh, mommy, it hurts, it hurts.
It felt like something was hitting it, and it hurt it more than just hitting it, hurt it more than anything in the world.
And, you know, as her mom, I tried to do as much as I could to minimize the pain, but I just knew that she had to ultimately go into the dentist and get the tooth taken care of.
It has decay.
82% of our children that we treat are insured through Badger Care. Their ability to access that care is very limited. The few dentists that may see that insurance and may accept that insurance may have a waiting list, or they're no longer accepting new patients.
The frustration that I felt with that was you have a child who has a toothache and you take them to an emergency, but they alternately need to see a dentist. And not to be able to get into a dentist when it's probably an emergency situation is frustrating.
In addition, we know that transportation is a big issue. They don't have the reliable transportation. They can't access that dental clinic miles away from their home. And again, that level of oral health knowledge, that the families don't quite understand the importance and the value of having good oral health.
Just gonna use some air, okay? Get that food off your teeth and see if you have any cavities or if they're nice and healthy here.
Pain from dental decay is actually one of the leading causes of school absenteeism. And you can imagine sitting in a classroom trying to concentrate, yet your mind is going to this pain in your mouth. And so the ultimate effect of that is that the child's not able to concentrate, they're not able to learn, and academically they fall very far behind.
You can't focus because the pain is so excruciating. How can you focus on what the teacher is telling you when you feel like this throbbing pain in your teeth? So yes, I would say that it did contribute to her missing a number of days of school.
I didn't want to go home because I would miss my friends and miss out learning, and I love to learn.
The most chronic disease that I see among school-age children is dental tooth decay. It's more prevalent than asthma and food-related allergies at this time.
When we lay the students back and look in their mouth, you can see holes in their mouth so deep, and it's like they can't even eat on that side. That side of their mouth is swollen. They can't even function. They have headaches.
What's alarming about that is that dental decay is actually the most common chronic infectious disease among school-age children, but it's 100% preventable.
I think that people tend to forget that oral health care is attached to the body. You know, they'll go to their physician and they're getting checkups, but then they don't go to the dentist every 6 months or as needed.
What we really aim to do in the Smart Smiles program is provide these students who have very little or no access to dental services the education component that they're able to then carry on and share with their families.
All right, so these are vitamins for your teeth called fluoride. They help to keep those teeth nice and healthy, okay?
So the teams of hygienists and assistants are in the schools providing one-on-one oral health instruction. They're showing the kids how to brush their teeth, how to floss their teeth, the right foods to eat. We have classroom presentations. So we are empowering these children and these kids in these schools with the knowledge to be able to take care of their oral health on their own and again, take that with them for a lifetime.
So it's really important that you do that before you go to bed, okay?
In addition, we've had experiences where children have shared with us that they were excited to be able to show their little brother or their little sister how to be brushing their teeth. And in some cases, these children are educating the parents on the importance of taking care of their teeth.
And I would encourage any parent to, you know, go ahead and sign that form and give Smart Smiles a try.
This last year, we have serviced 58 schools, and I'm happy to report that we have reached 10,000 kids this year.
10,000 is really important because that's a lot of children that we've been able to reach out to and give them the health and the hope of, you know, good dental health.
You need to eat healthy foods, brush your teeth twice a day, and floss your teeth every day. It felt really good to not have it anymore, so I could go back to school and have fun and do a lot of work again.
These are going to help keep your teeth strong and healthy. Okay?
Our vision is to ensure that at Smart Smiles schools, a child will never fall behind in education because of dental pain or disease. With your help, we will meet these urgent needs with the next generation of Smart Smiles by creating the area's first mobile dental clinic, Miles of Smiles. Miles of Smiles Mobile Dental Clinic will travel to area schools where a dentist will diagnose and treat children with cavities, infection, and other urgent dental issues. By bringing treatment to children right at their school, the Miles of Smiles Clinic will complete the treatment loop for these children in need. As the Ascension Columbia St. Mary's Miles of Smiles Mobile Dental Clinic helps children get healthy, pain-free, and ready to learn, you can be proud that your gift will create miles of smiles throughout our community.
How are you today?